is Dr. Linda Stein Gold, and I'm the Director of Dermatology Clinical Research at Henry Ford Health in Detroit, Michigan. I'm also a medical dermatologist. And this has been a really exciting American Academy of Dermatology meeting here in Denver. Today I have given 2 lectures so far. One of them was in atopic dermatitis. This was a late-breaking poster or late-breaking abstract, and we talked about nemolizumab and a clinical trial looking at the younger pediatric population, ages 2 to 11. Nemolizumab is already FDA approved in the United States for moderate to severe atopic dermatitis in age 12 and up, also approved for prurigo nodularis in adults. And this was an open label study used with topical steroids. We looked first at patients aged 7 to 11, make sure we have a pharmacokinetic profile that's similar to what we saw with the adolescents and adults. And we adjusted it a little bit and finally came up with a dosing regimen that allowed us to have a PK profile that was very similar to what we saw with the adolescents and adults. And overall, we saw good efficacy, even better efficacy in the short term as compared with the older patients. And this efficacy was continued over the course of 52 weeks. We didn't see any major safety signals. The drug was well tolerated. So hopefully this will be a new option for even our younger atopic dermatitis patients. I talked also today on a new drug that was just FDA approved for plaque psoriasis. This is an oral peptide called Icotrokinra. It's a peptide that we take once a day in the morning on an empty stomach. And it was FDA approved really just about a week ago for patients with moderate to severe plaque psoriasis down to age 12. The data I presented today was a longer term analysis. We have a study that looks at Icotrokinra as compared not only with placebo, but also as compared with deucravacitinib. And we saw a very nice onset of action for the drug, better than deucravacitinib. Probably 2 times as many patients got to clear, almost clear with Icotrokinra as compared with deucravacitinib. And then they maintained that effect over the course of 52 weeks. What was also really important is the safety. The safety was similar to placebo. They actually had less infections as compared with deucravacitinib. And as patients use this medication over the course of 52 weeks, we didn't see any new safety signals. When we look at efficacy over time, at week 52, the average PASI reduction was about 90%. So good news there. We have a drug that is an oral option. It's pretty much as efficacious as some of the biologic agents. It has good safety and good tolerability, so I think this will fulfill an unmet need.